All right. Good morning, everyone. Thank you all for taking the time to join us today. We're going to be discussing how IVR can enhance your pharmacy operations and improve engagement. And here's what we'll cover today. We'll start with a high level look at IVR, how it works, and why it's essential for modern pharmacies. Next, we'll discuss the tangible benefits from streamlining operations and reducing call volume to improving patient adherence and driving revenue. Then we'll share practical strategies to set up and fine tune your IVR system, making sure it works seamlessly for both your pharmacy team and your patients. Then we'll walk through step-by-step experience for patients and providers, showing how to navigate the system and access the services they need. And then finally, we'll explore what sets our IVR solution apart, highlighting the unique features that drive better results for your pharmacy. And by the end of the session, you'll have a clear understanding of how IVR can transform your pharmacy's efficiency and improve patient engagement. We will take questions towards the end of today's presentation using the questions feature in GoToWebinar. Simply to your questions throughout using the chat feature, and we'll do our best to answer as time permits. If any questions happen to go unanswered, one of our product experts will follow up with you. So be sure to include your email address so we can follow up with you promptly. But before we dive in, I want to go ahead and introduce Danette Garcia, Product Manager with Outcomes. She has over 15 years of experience working with IVRs, engagement channels, and telephony solutions. Her expertise and dedication make her an invaluable leader in helping pharmacies thrive. With that, I'll go ahead and hand it over to you, Danette.
Thank you, Siobhan, and thank you everyone for joining me today to discuss my favorite product, Inbound IVR. So our Inbound IVR at Outcomes is our automated system that answers your pharmacy phone calls 24 hours a day, 7 days a week, and it allows your patients to easily check their prescription status and get refill requests without ever speaking to somebody in your pharmacy. So you can see from what we are offering automated, it's definitely going to help your pharmacy's efficiency by reducing that call volume that your staff has to answer. So some of our solution features that I want to point out right now are the integration with your PMS. So we seamlessly work with your pharmacy management system so that we get that data for your patients to be able to check the status of those prescriptions and get the refills requested and pushed to your PMS directly. We are a hosted cloud-based system, so there's no equipment for you to purchase or install in your pharmacies. And we have high availability. So I mentioned it's available 24/7 to your patients, but we also have support that monitors our systems. And we have what we refer to as geo-redundant failover. So we have servers on both coasts of the US that if there is an issue or some sort of disaster on one coast that takes some of our servers down for the IVR, we have automatic failover that fails over to our other servers, which means that you have a high availability of your IVR being available to your patients and not having any patients' calls that are not answered being available to them at all times. One of the differentiators that I want to point out is that we all have the ability to help generate revenue directly in our IVR. We can offer our clinical opportunities to your patients by connecting them with opportunities and either connecting to your pharmacy or scheduling an appointment for those in the future. And then we also have our intelligence built into our IVR where we can use the data that we have in your pharmacy management system to recognize your patient's phone number, and then we can proactively provide them with relevant medical information and help them get through that automated phone call quicker and seamlessly and easier for them. Okay, so here I just want to go through some of the efficiency and patient experience and some of the additional features and configurations that we have available with our IVR. This isn't an all-encompassing list, but this is some of the different features and things that we can offer with our IVR. So we offer both English and Spanish, depending on what works for your pharmacy. This is a configuration where if you want Spanish, you can sign up for it. If you don't need Spanish for your pharmacy population, you don't have to have it. We do have the ability to customize the business hours within the IVR to make sure that your patients are receiving accurate information even during holidays and lunch breaks. And so what this means to you is if your pharmacy does close for a holiday or has a lunch break during the day, if a patient is to be transferred to the pharmacy, we will send it to your voicemail where they can leave a voicemail for your pharmacy, and we'll let them know, of course, your hours that you're open and closed. We do have secure encrypted voicemail for both your patients and your doctors that are calling in, so you don't have to worry about them leaving PHI on your voicemail and having any issues with that. It is fully encrypted and safe for them to do that. We have the ability for you to add a customized message of the day to your IVR. So this gives you the ability to keep your patients informed of timely updates. You can use these for flu promotions, or if you have to close due to inclement weather. Anything that you want to put on that message that's relevant to your patients, you can do, and it's fully customizable by you in the pharmacy. We offer flexible menus, so we have, I'll go through in a later slide, our IVR menu, but we have the ability, if you need additional options, to say speak your fax number or add an additional transfer to a different department in your pharmacy. We have the ability to tailor the system to meet those needs for you. I hit on this one a little bit in our previous slide, but we do recognize your phone numbers that your patients and doctors are calling from. And so we also have an option where your doctors can choose to save their phone number so that they don't have to go through the full menu of our IVR every time they call. They can go directly to the doctor menu where they can leave a message or speak to your pharmacy to let you know about prescriptions for their patients. And then we do have comprehensive reporting for our IVR that gives you the ability to both real-time and see both real-time and historical IVR data. And this just helps you make better decisions and operational efficiency for your pharmacy. Okay, so let's talk about some best practices for implementing your IVR in your pharmacy. So some of the things that I recommend is that we keep those menus and messages clear and simple. And so I talked about in the previous slide that we have the ability to add additional menu options, and we have the ability to add a message of the day. But when we do that, we want to make sure that we're not overwhelming your patient. So right now we have 5 main IVR options. And so if there are things that you need to add, like transfers to another department, we want to keep those very simple, and we don't want to add too many options to the IVR to where we lose your patient's focus and then they just want to transfer and speak to somebody rather than using the automated system. And the same with the messaging. If we are going to put a message of the day out there, keep it short and simple and to the point, because we don't want to have a long, lengthy message that a patient is listening through and then ends up hanging up and calling back or trying to use a different method. We really want them to stay in the system and take care of what they need without having to speak to your pharmacy, so that you can have that efficiency to work on other items in the pharmacy and let your patients self-serve themselves in the IVR. And then I recommend educating your patients, whether you have a current IVR and you're switching to our outcomes IVR, or if you don't have an IVR in your pharmacy and this will be the first one that you have. Before we get this implemented, and even as it's being implemented, just talk to your patients about it as they come in the pharmacy. Let them know that they are able to use it to fill their prescriptions or request refills or check the status. They can leave you messages if they just want to simply know if you're closed for a holiday or what your hours are. Let them know the things that they can do in the IVR and get them comfortable with it so that they will want to use it. Let them know those features and how it's quick for them. They don't have to wait to speak to somebody in the pharmacy, and just basically educating them and getting them to want to use it. And then keep the contact information up to date in your pharmacy management system for your patients. This is very important because the most efficient way to use the IVR is if we recognize your patient's phone number, we can proactively tell them what prescriptions they have waiting for pickup or that are in process, and what refills they have that they may need that are ready to be refilled. If we don't have up-to-date phone number information, then we won't recognize it in the automated IVR, and they'll have to go through the menu options and choose refill, where they'll need their prescription number. So if we can make it as simple for them and as easy for them to just call in, we recognize their phone number and give them the information they need and get them off of the phone, they will have a better customer experience. And so if we can make sure that we have those phone numbers for them, then we're able to do those recognitions. And then integrate our IVR with our other engagement channels that we offer at Outcomes to maximize your outreach. We have text messaging that we offer, outbound IVR calls for appointment reminders and prescription updates. And if you use all of these products together, you can have different engagement channels that your patients are able to use, just depending on what their preferences are, and you can stay in contact with them all of the time. Okay, so this is our basic IVR call flow that I had talked about in some of our previous slides. So I just want to go through this quickly. It looks a little overwhelming, but it really is quite simple as I talk you through it. So your phone call, your patient calls your main pharmacy number, and that comes through our telecom vendor, which is Call Tower, and comes into our automated IVR system where they will hear a welcome message. This is customized by the language that you want for your pharmacy. So mine could say something along the lines of, thank you for calling Danette's Pharmacy, located at 123 Main Street. And then I would have that customizable message of the day. So say I have a flu clinic coming up this Saturday. I could simply say, join us for our flu clinic on Saturday, walk-ins are welcome. And then if it recognizes my phone number, then it'll go directly into that proactive menu that I was telling you about, where it would say, hi, Danette, I show that your lisinopril is ready for pickup. We're still processing your Ozempic, and you have these 3 prescriptions ready for refill. Do you want to refill your atorvastatin? And it'll go through the different prescriptions, and I can choose whether I want to refill them or not. If the IVR does not recognize my phone number, or I'm calling from a phone number that is not in your pharmacy management system, then it will go into a welcome menu where it will just say, what can I help you with today? And it'll say, for refills, press 1, for status check, press 2, for our prescriber menu, press 3. And then there's a sub menu for your doctors to either speak to, transfer to a pharmacy representative, or to leave a voicemail. And then option 4 are hours and direction information to your pharmacy. And then option 5 is to transfer to your pharmacist. And so it is just a simple 5-option menu. If it's after hours, then we will let the patients know that the pharmacy is closed, and then we'll transfer them to voicemail where they can leave a message for you. They still have the ability after hours to request a refill, do status checks, listen to the hours to see when you are open. They can do everything in the IVR as if you were open, except transfer to the pharmacy. They would then transfer to voicemail. Okay, so now let's talk about how we stand out with our IVR versus some of our competitors. The biggest thing that we can do is those clinical opportunities that we talked about in the IVR. We're the only company that offers this. Our competitors don't have the ability to do these. So we have the ability to offer those CMRs and tips and vaccines to your patient in the IVR. And the way that this works is after they have either requested a refill or checked a status on one of their prescriptions, then they'll hear a message that just says something along the lines of, before you go. And then depending on what our algorithm has decided is the highest priority opportunity for that patient for your pharmacy, then we will offer that to the patient. And we have a ton of customization that you can do in this space with your pharmacy. You can choose which opportunities you want to offer. So if you don't want to offer generic conversions, you don't have to. If you don't want to offer the 30 to 90 day conversions, you don't have to. Vaccinations you can offer. we have a whole slew of vaccinations that you can offer as an opportunity. But if your pharmacy only does flu and COVID, then those are customized and those are the only things that your patients will be offered. So we have a lot of customization that you can do around which opportunities you want to offer. And then also once you pick which opportunities you want to offer, you then can customize whether you want to offer the ability for a patient to be transferred directly to your pharmacy, transferred to a call center if you have either a person or a group of people that you want to answer specific calls on CMRs or vaccinations. We can transfer them there, or we can offer a callback where you will get a list of patients to call back at your convenience and speak to them about those opportunities. And those three options are at each individual opportunity level. So meaning if you want to speak to patients immediately about a CMR and have them transferred to your pharmacy, but you want Medicare plan opportunities to be on a list to call back later so you have more time to have those discussions with your patients, you can do that. And so these work seamlessly with your operations of your pharmacy. And I do have a couple of clips that we can listen to for some of our opportunities so you can hear what those will sound like in the IVR. The first one we're going to listen to is our CMR opportunity. Siobhan, can you see if you can play that?
Were you able to hear that?
I wasn't able to hear that one.
Okay, let's try this real quick. Okay, I'm gonna try again. All right, apologies, it doesn't seem to want to play today. So unfortunately, we won't be able to play that for you guys.
No problem. I can talk through what those sound like a little bit. So for the CMR one, it will just give them the message like, before you go, our pharmacist wants to talk to you about your medications and how we can optimize those for you. Do you want to speak to a pharmacist now? And you could press 1 to speak to a pharmacist, or no, you don't want to for 2. The vaccination ones would be customized by the vaccination that you're offering. So it would say, today you're eligible for the Shingrix vaccine. Are you interested in speaking to a pharmacist about scheduling that? And then 1 or 2 to transfer to the pharmacist. And then the others would sound very similar, just with whatever the opportunity type is. We'd like to talk to you about your Medicare plan enrollment today. And those are some of the different ones, but we have many more than what I have listed on the screen for you. So when we move forward with IVR, our implementation team can go over all of those and pick and choose what works for your pharmacy. Okay, so I want to talk a little bit about our intelligent IVR, the higher engagement and our better outcomes that we see. So why our IVR works better is we have that smart prioritization where you can hear that one opportunity that is best prioritized for your patient. So we want to make sure that since we have their engagement and their attention in the IVR, this is your opportunity to drive additional revenue with that patient. So we want to offer them that one opportunity that is tailored to them, that we feel is the highest priority, and can offer you the ability to generate additional revenue in our automated system. You're going to have increased engagement with your patients. The patients will respond better when these calls are strategic and tailored to them, which is why you have the ability to customize those different opportunities to what you offer and want to offer in your pharmacy. And then we have our internal intelligent algorithms that determine from what you're offering, what is the best one for that patient. We are only going to offer 1 to them in every call because we don't want to overwhelm them. But that's why we pick that highest priority one. And then once they decide if that is something they are interested in or not interested in, on future calls, they won't hear that same opportunity. They will hear a different opportunity that is now the next highest priority for them. So this has a stronger business impact for you. It drives adherence. revenue and operational efficiency. So when your patients are able to handle their own prescriptions in the IVR, they're going to be more adherent. They're going to stay on schedule as we remind them that they have refills that they maybe weren't even calling in to refill. And then giving them those opportunities to just have additional revenue for your pharmacy. And then handling so much of this in the IVR through an automated fashion to free up your staff to work with patients that are in your pharmacy at that time, or to work their normal workflow and get prescriptions filled and ready to be picked up by your patients. More of these completed interventions equals higher revenue. So the more of those that we can offer to your patients when we have their attention and their engagement, they're calling you in the IVR. You're not reaching out to them. So they have a higher likelihood of listening to those messages and saying, yes, I do want this today, or no, I don't, because you already have their attention. They are calling you because they want to speak to you about something already. Better patient experience and improved loyalty. We talked about this a little bit in the earlier slides, but they're able to access your IVR 24 hours a day, 7 days a week. So they can request their prescriptions, check their status at times that are convenient for them. They don't have to wait for you to be open. And it just gives them that empowerment to handle their prescriptions when they want to, how they want to, and as easily as they need to. And then just less of a staff burden for you, better efficiency. We've talked about that on many of the slides. We see a 50% reduction in call volume for our pharmacies that don't have an IVR versus our pharmacies that do. Or for pharmacies that do have an IVR versus pharmacies that don't. You'll see a 50% less call volume coming into your pharmacy. And also with some of these smart features that we offer, like recognizing the patient phone number, we can see an even higher containment rate in your IVR to where even fewer calls can be transferred to your pharmacy.
Awesome. Thank you, Danette, for taking us through Outcomes IVR and how it really benefits our pharmacies. Looking here, got a few questions that came in. So just as a reminder, if we don't get to all of your questions before we end, make sure to include your email address so we can follow up with you after the webinar. Okay, give me just a minute. I'm going to take a look and see what all we have here. All right, Danette, we have one. So we currently use Ring Central. Would this be a replacement for our current phone solution or a supplement?
It would really be a supplement. So you can keep your same solution. It depends on how you have it set up. So what we would do is we would take your main pharmacy phone number, so the number that your patients are used to contacting you on, and we would ask to port that to our telecom provider. And that is just meaning you still maintain control of it. You still own the phone number. It just makes it easier support wise. And then we would connect that phone number into our IVR system. You would have another phone number that transfers back to your pharmacy for when a patient does need to speak to somebody in the pharmacy. So you have to have at least 2 phone numbers, but you could keep all of those things with Ring Central that you have today. And then that would be a specific situation where we can talk through at implementation time of how you have that system set up today. Do you have an auto attendant where you have some menu options already that you want us to take over? Or does it ring straight to your pharmacy and you just have your phone system set up? So we can talk through those at implementation. But yes, we can work with your existing phone system and then talk through auto attendants if you have those set up today, like greetings and transfers to different departments.
Great, thank you, Danette. Let's see. Can you forward to an internal voicemail system that we use?
We can. So we have 2 options. You can use our voicemail system, or if you already have one in your pharmacy that you use and you like, we just have to have a phone number that we can transfer to your voicemail versus using ours. And we can do that for both your prescriber voicemail and your patient voicemail if you want to have separate or just one for both.
Okay, let's see. Can the IVR work with any phone system that we have in place?
We have seen that we're able to integrate with the phone systems that you have in your pharmacy. We don't take over your phone system. You use what you have already, so you don't have to buy any new equipment. and then we just use that main pharmacy phone number to send the calls to our automated IVR system.
Okay, and what is the pricing for IVR?
So we have a couple of different packages that we offer. We have a basic package, which is our English package. It runs $150 a month, and that one has a 2 cent per minute fee for the usage in the IVR. Then we have our basic with Spanish package, which has the same options as our basic package, but it does have the Spanish language option, and that's the only difference. And that one runs $180 a month with that same 2 cents per minute fee for usage. And then our third option is our premium option. And that's where if you want to add those additional menu options to your IVR, then that would be the package that we would be looking at there. And that one runs $200 a month with that same 2 cents per minute usage fee. So the usage is consistent across all packages. And then we do have one-time implementation fees for setting up each of those packages. The basic and basic with Spanish is $1,500 one-time fee, and the premium is $2,000 one-time setup fee.
Okay, let's see, got a couple more coming in. Is this functionality separate and distinct from the texting refill request function?
It is. It's separate than the texting function. It's two separate products that we have. We have our engagement products that include the texting solutions and the outbound IVR and the other solutions that we offer. Inbound IVR is separate from that.
Okay. And then can IVR be used with a different patient processing system like PK software?
We are not set up for, that's your pharmacy management system. We aren't set up with PK software as of right now, but that is something that we can talk through. So if you want to leave your email address, we can touch base separately on that. What we work with right now is, of course, RX30, Computer RX, McKesson Enterprise, and then Micro Merchant. If you have a pharmacy management system other than those, then if you leave your email address, we can have some discussions on those and what that looks like.
Okay. We've got a couple more minutes left, so I'm going to try and squeeze in a few more. Which phones do you use?
So we actually do not offer a phone system. We offer the inbound automated IVR system that just integrates with your existing phone systems.
Okay. All right. Let's see. What if the pharmacy utilizes multiple phone lines?
You could keep those multiple phone lines. I think I mentioned earlier that we need two phone numbers, one which is your published main number that transfers into the IVR, and then one phone number that transfers back to your pharmacy. But if you have multiple phone numbers from there, it just depends on how you have it set up. A lot of pharmacies will have their phones set up to ring from one to another. So if one's busy, it rings to the next one. You would keep that existing setup. We don't make any changes there. Or if you have specific phone numbers where you want different types of, like your prescriber phone number is different than your transfer to your pharmacy phone number, then we could accommodate those in the IVR of transferring calls that way. And again, if you have a different phone number for your voicemail, we can accommodate that. Also, if we set up additional menu options that we discussed in that premium package, and you have, say, an option 6 where you want to transfer to a specialty pharmacy or another department, and that's a different phone number, then we could do that as well. So there's some customization there. Those would be more, we would get more in depth on that topic with implementation and really figure out the requirements of how we need to set up your specific situation.
Okay. I know we're running out of time, but one more I want to squeeze in. I know that you mentioned that we work with, we integrate with PrimeRx. Do we integrate with Pioneer at this time?
We don't at this time. That's another one where if we want to have a discussion, just leave your email address and we can look at future expansion and enhancements to the IVR and some of these pharmacy management systems.
Great, thank you. And one more, I want to squeeze this one in real quick. How long does implementation usually take?
It depends on how quickly you get back with us on some of it. So we will have, I will say our general timeline is 30 days to 6 weeks, but that depends on, we have our implementation consultants reach out to you with a welcome call, and there will be some forms and some information that they need back from you. So if you as a pharmacy get back to us very quickly, then we can move that process along faster. But right now we do run 30 days usually, up to 90 days is what we're kind of looking at, depending
Great.
on, what you have right now.
Awesome. Thank you, Jeanette. And thank you everyone for your engagement and all of the questions. If we were unable to answer your questions during this webinar, we will be sure to follow up with you afterwards. So again, please make sure that you include your email address in there, and we will follow up with you, as well as a reminder email, as an email we will send out after the webinar, including a copy of this webinar in case you need to share with staff members that weren't unable to attend. And again, thank you guys for joining. We really appreciate you. Thanks,
Thank
Danette.
you.